am Julie Carbright, clinical professor of psychiatry and nursing at the University of Illinois, Chicago. And I'm joined by my colleague, Andrew Penn, clinical professor at the University of California, San Francisco. As clinical professionals in the field of psychiatry, we're thrilled to share some details with you about a brand new educational offering created exclusively for nurse practitioners by the field leaders of PsychCongress, the NP Institute. Andrew, are you excited about this?
Oh my gosh, Julie, thanks for that introduction. I couldn't be more excited or more ready for what this new year has in store for us and for this new meeting.
Andrew, you and I both know that in the field of psychiatry, there's always something to learn, even at our age. New nurse practitioners, however, are eager to jump into their practice. And there's something that stood out to me in all of the conversations I had with our new nurse practitioners, and that is they're really looking for something to build their confidence and competence as they emerge into our field. And that clarity and confidence in their new learnings is really what we were trying to translate in this meeting.
Yeah, I think, you and I can agree that most NPs really leave school still hungry for knowledge, which is great. You want to keep learning your entire career. And, with the demand following the pandemic, for increased access to mental health and psychiatry services, NPs really want more. They want more in-depth foundational education that's really tailored specifically to our practice. And this PsychCongress NP Institute begins to fill that educational gap. And by coming to this meeting, people who come to this meeting are going to be able to go on to PsychCongress or Elevate in the years afterwards and really find that to be an even richer experience.
Yeah, you're right, Andrew. This is really a launch into continued learning for our new nurse practitioners. And this is the first year of this event, and it's in person, which makes it even more exciting. And I'm sure people are wondering what to expect across this meeting. So let's take a look at this agenda. The conference is going to kick off on Friday, April the 28th, with a welcome and orientation where our steering committee members are going to provide insight into what all of our attendees can expect across the meeting and what they hope that our attendees will gain. Our nurse practitioners are going to hear about all of the great things that the NP Institute offers and how to get the most out of the experience while they're in Boston with us.
Yeah, that first session is one that you're not going to want to miss. And then shortly after that, we'll get into our accredited sessions, one which I'm participating in called Principles of Psychopharmacology. And I'm going to be joined by my colleagues, Dr. Rakesh Jain and Dr. Craig Chepke. And in each of these meetings, each of these sessions, they're going to be run by an NP expert, supported by experienced colleagues in the field, like Dr. Jain and Dr. Chepke. So in this first introductory course, we're going to lay the groundwork for attendees to really understand pharmacology from a foundational level. And then when we go forward into the rest of the sessions throughout the weekend, we're going to be focusing on different classes and different disease states for medication and psychopharmacology, looking at things like depression, bipolar disorder, anxiety, schizophrenia, and addiction medicine.
That's going to be a great first session to kick off the conference. And during the remaining 4 days, April 28th through May 1st, these sessions will be broken out into 3 session types: deep dives, master classes, and short courses. We're going to cover everything nurse practitioners need to know, from traditional medications to what's new on the market these days. Medication classes, including antidepressants, antipsychotics, mood stabilizers, and stimulants, are also going to be covered in depth. And psychiatric disorders like ADHD, anxiety, bipolar, depression are going to be explored as well.
Yeah, that's right, Julie. These are such important topics for new NPs to dive into and be able to take this knowledge back to their own practice and immediately implement what they've learned. And we're also going to cover some non-medication topics that are related to practice management, such as the most common billing errors, documentation best practices, and more. So, Julie, what are you going to be presenting on?
So, Andrew, my presentations will include a comprehensive guide to mood stabilizers. I'll be giving that talk with Jonathan Myers, best practices in motivational interviewing, along with Sandra Jan, and our closing session, bringing it all together, next steps as our nurse practitioners return to practice.
Oh, I'm really excited to hear all of those and all of our other presenters. I think this is really going to be a meeting that new nurse practitioners are not going to want to miss.
They sure won't. And the Nurse Practitioner Institute will be an essential educational experience if you're a nurse practitioner. Join us in Boston along with hundreds of your peers and get ready to build that confidence and solid footing for your psychopharmacologic practice. This event will provide you with resources as well for continuing your learning for years to come, and also introduce you to our Psych Congress family.
Yeah, we look forward to welcoming you into that Psych Congress family, and we hope to see you there in Boston.